Greetings. This is the healthcare policy in regards to Australian healthcare system. We are going to discuss the cost, the coverage, and the quality and the choices for the Australian population for their system. This is the final presentation under Professor James Patterson class of Health Policy Making. I am Tristan McCauley. Let's get started. Australian coverage. So there is a two-tier system in Australia. There's a public and a private sector. The public system is funded by the government through taxes and also funding from private insurers. The public system is a Medicare type system where everyone receives access to care. Care is free or subsidized for those in the private sector. The private system is for those who wants to pay for their own insurance and have their own choices of doctors, and they also can pay as you go. The private sector personnel get seen in their own hospitals. The wait times are less, and they get to once again choose their providers, while the public system population, they get seen in public hospitals, and they get seen for free, but the wait times are a lot longer, especially for elective surgeries and specialists. The cost, so Australia's cost is a lot lower than the United States. They spent 9% of their healthcare expenditures on the GDP, while the U.S. spent 18% of their funding on healthcare from the GDP. Once again, as far as the services, if you're on the public system, your services are free or subsidized. If you're on the private system, then you pay for your services monthly, like with the premium, or you can do pay as you go for the services. Generally, their medication costs and everything is a lot lower as compared to the United States, and they spend about 18% of their funding on medication. And next is the quality. So the quality for Australian healthcare, per the OECD, is good. Compared to the United States of America, their quality of care is good, and their wait times for 4 months or longer is a lot higher than that of the United States. But once again, it's because they do have that public system where everyone gets health care. Looking at the statistics, their reviews for patient satisfaction surveys were much higher than their peers, Canada and France. They were above 40% of reviewing their patient satisfaction surveys, while Canada and France were below that, which is very important because that deals with innovation and seeing what the patients say is good or bad in regards to their system. Also, their percentage for reviewing medication checklist is higher than that of Canada and France, which is good as well, because this lets us know that the providers are reviewing the medication list to make sure that the patients are not getting the wrong medication or the wrong amount of medication, so forth and so on. So they are taking the steps into the right direction as far as reviewing those lists. And then in conclusion, the Australian healthcare system, once again, their quality is good. Their money, their spending is a lot lower than that of the United States. They do have a two-tier system of publicly and privately funded. The private can go to a public area. However, they will have to pay, being that they do have private insurance. The public gets the free healthcare, but with free healthcare for them, they do have longer wait times, especially when it comes to elective surgeries or specialists. The private sector, they do get seen fairly quicker, once again, because they're paying for their healthcare. Also, something to note with the Australian healthcare system is they do focus on preventative healthcare as well, childhood obesity and things of that nature. So I thought that was very interesting. Definitely a system that we in the United States can look into as a two-tier system like Australia. All right, that is my take on the Australian healthcare system. Thank you and have a good day.